All right, so we're going to get started. Good evening, everyone. My name is Karima Woodyard. My pronouns are she, her, and hers, and I have the pleasure of serving as the Director of Student Involvement within the Division of Student Affairs here at Rutgers University, New Brunswick campus. This year, in response to the pandemic, we have altered our Women's Herstory Month programming to continue to engage our community throughout this very difficult time. This year, we commemorate 5 years of furthering the legacy of Dr. Jewel Plummer Cobb, former Dean of Douglas College, President of California State Fullerton, and scientific researcher, as well as highlight the current movers and shakers who are shattering glass ceilings within our communities. Our theme for this year is reinventing your journey holistically in the age of COVID-19. Which truly speaks to the impact COVID-19 has had on our overall community. I can't tell you how excited I am to tune into our discussion tonight, entitled Girl Talk, Women of Color Talk COVID-19 Vaccinations in Communities of Color. During this critical conversation, we intend to speak openly and honestly with professional women of color about the COVID-19 impact on Black and Brown communities. I am thrilled about our panel. I know many of them personally, including my Aunt Kim, who has been a huge influence on my life and my career. Our expert panelists intend to engage in real talk about COVID-19 vaccinations, dispel myths, and answer any questions. These women have been at the front lines throughout the entire pandemic, and I, as someone who has been personally dealing with vaccine hesitancy, look forward to learning from these amazing women. We thank you for joining us today and invite you to visit steam.rutgers.edu for more information about the amazing initiatives we have planned throughout the month. Friendly reminder that this event will be recorded and it will be shared on our Student Centers and Activities YouTube channel for you to view at a later date and to share within your network. If you are a Rutgers student, please use the link in the chat to check in. Let's jump right on in. Tonight's discussion will be moderated by two phenomenal women who serve huge roles within the Rutgers community. I am honored to introduce our first moderator and mentor of mine, Dr. Felicia McGinty, Executive Vice Chancellor for Administration and Planning here at Rutgers University, New Brunswick. Dr. McGinty leads and directs day-to-day non-academic operations at Rutgers University, New Brunswick, including space management, infrastructure development, policy implementation, and other critical functions that support the student experience and advance the Rutgers University, New Brunswick academic, research, and service mission. It is now my pleasure to introduce our fantastic moderator, Arielle Dublin, or Ari, as she is called by her community. Ari currently serves as the Student Body Vice President for the Rutgers University Student Assembly. Introducing our superb moderators, Dr. Felicia McGinty and Arielle Dublin.
Good evening, ladies. We are so excited to spend some time with you and to hold this space with you this evening. So I want you to relax, let your worries go, and be ready to engage in a thoughtful conversation about COVID and its impact on our communities. Now, when we envisioned this session, we thought about what are the places where we're relaxed and we can talk and engage with one another, and the beauty shop is that place for many of us. I know it is for me. So if you think about going to get your hair braided, a natural, whatever you're doing, and you're in that relaxed space and your girls are there and you can just talk and catch up on information and find out what's going on. I want you to see this as that kind of space. So we're going to do two things. We're going to keep it real and we're going to give you facts. So tonight we've got a great panel. You're going to hear more about them. We're going to ask them some questions. You're going to have an opportunity to propose some questions as well. And we want this to be interactive, just like it is at the beauty shop. So sometimes you're lurking because you're underneath the dryer. And then when you can get out of the dryer, you want to go back and say, hey, what about this or what about that? That's this space. So relax, enjoy, and be ready to get engaged. That's my advice. Ari, you have any thoughts?
No, I wanted to also say thank you so much for everyone who joined us for this conversation tonight. I'm looking very, very forward to hearing from each and every one of these beautiful women of color, number one, that of just distinction in their own fields, being able to talk about this conversation on COVID, because everyone's been affected in certain ways of this pandemic. I know me and Dr. McGinty, from more of an academic standpoint, have seen the effects of COVID in our community, but it's very important for us all also hear that from other people as well, especially as this month being March, and it being more of a highlight for women, of course, is even more impactful for us to hear from these specific bunch of women who are on this call today. So sit back, as Dr. McGinty said, relax. This is going to be more of a relaxed conversation to hear from everybody, and participate. Be able to ask questions. Feel free to ask us any questions, because I know all these women who are part of this conversation today are very insightful in their own fields, and they really want to talk more about what they saw and how to help more of our community as a whole.
Awesome. So our lineup tonight is amazing. So I'm going to introduce you to some of our experts, and Ari will introduce you to others, but it's an amazing lineup. So I want to start first and introduce Dr. Tolu Oyetunde. Dr. Oyetunde was born in Lagos, Nigeria, but came to Rutgers, having completed both her undergrad and her medical education at Rutgers. She's currently an anesthesia resident at Temple University in Philadelphia, and she also serves on the board of trustees. She is thebomb.com. We're so excited that you're with us tonight, Dr. Oyetunde. Our next panelist is Johanna Calle, and she is the Senior Policy Advisor in the Office of the New Americas at the New Jersey Department of Health and Human Services. In this role, Ms. Calle works in identifying and developing and executing policies and strategies to advance efforts to welcome and empower immigrant communities throughout the state of New Jersey. She's also a Rutgers alum. She earned her master's at Rutgers. We just skipped over her undergrad. And then next, I'd like to introduce you to Aunt Kim Nesbitt Good. Well, she's actually Kim Nesbitt Good, but we're going to call her Auntie Kim because she's the best. Aunt Kim is a proprietor of the Nesbitt Funeral Home in Elizabeth. She studied at Union County College, as well as the world-renowned Academy of McAllister Institute for Funeral Services in New York. Let me just say that she is a lifelong learner. She is an entrepreneur extraordinaire and a wonderful event planner. And she has a great perspective that she's going to bring to you this evening about COVID as well. So as you think about each of the three panelists that I just introduced, we have a medical doctor. We have a person who works for the state of New Jersey in human services with a specific emphasis on immigrant communities. And we have a person who owns a funeral home. All of these areas have been essential throughout COVID. So we are honored to have you with us tonight, ladies, and we are looking forward to the conversation. And I'm going to kick to you, Ari.
Awesome. Thank you, Dr. McGinty. So I have the pleasure of introducing these next two women, beautiful, strong women as well. Firstly, I get to introduce Marcia Sill. I know Marcia for the majority of my life, so this is fairly easy for myself. Marcia right now is currently a clinician at Solano Medical Associates located in East Orange. She has been a big input, especially during this COVID pandemic, helping a lot of homebound patients right now who've been affected. And this is right now a big part of the organization, making sure generally our clinical staff is meeting their needs and everything. Marcia has also been a director of nursing the majority of her life as well in different areas within New Jersey, and she is a strong Jamaican woman. So I know she's going to have a lot of input on just more of the a medical background as well for this conversation. And then lastly, but not least, I get to also introduce Council President Patricia Perkins Augusti. She is the first African-American woman elected to Elizabeth City Council in the 355-year history of the city. And in August of 2020, during the pandemic alone, Councilwoman Perkins additionally assumed the responsibilities of the interim business administrator of the city per invoice. She's also a graduate of Rutgers University as well, which having a BS in marketing. So these two beautiful, strong women come from two different backgrounds, but they have been able to help so many people within New Jersey alone. Councilwoman Perkins helping more of the governmental side and making sure people have been helped from that input. And I know Dr. Sill has also been helping and making sure that we have patients right now who are able to be safe, during the pandemic, especially elderly patients within the urban communities of Newark and Orange as well. So these are two strong women from two different backgrounds, making sure during this pandemic, people have been able to thrive. So I'm going to pass it back to Dr. McGinty with our first question.
Wonderful. Thank you so much, Ari. So let's get this party started. I'm going to pose the first question, and we're just going to do a little round robin. So I'm going to ask each of our panelists, starting with Dr. Oyetunde, to please introduce yourself in 2 to 3 minutes and to talk about COVID-19 and its impact on the area of your work. Dr. Oyetunde, we would really like to hear that from you because we know you've been on the front lines as an anesthesiologist.
Hi, everyone. Thank you so much, Felicia. And you guys can all call me Tolu. Dr. Oyetunde is my dad. But yes, my name is Tolu. I am a anesthesia resident at Temple University. I actually started my training though last year, July of 2019, in Rutgers in Newark, as a surgical resident. And it was actually quite interesting. You graduate medical school and you're getting ready to go start your career and you're, trucking along and trying to find your footing. And all of a sudden you are smack dab in the middle of a pandemic. I will tell you, nothing could have prepared me for that at all. To see so many sick patients in a way that we've never seen them before. For example, a family can come in, someone's complaining of shortness of breath, and within hours deteriorate. And at first, not really knowing what's going on till all of a sudden we kind of start recognizing some of the symptoms, some of the signs, and being able to pick it up really quickly. But I want to say in March and April, if you came in with that diagnosis, many people did not leave the hospital. And in the beginning, because there were so few resources, a lot of hard decisions had to be made that early. So now if you have the diagnosis with everything the advancements that we're making with this virus, you kind of have a fighting chance. Last year, when I started, it was almost a death sentence when you started. And it was sad because people had to go through that all alone. And I want to say if you were put on a ventilator, there was a chance that you were not going to come off that ventilator. I do remember my first patient that we had actually leave the ICU, and we all formed a line to clap for him, because we hadn't had one in a very long time. I was at East Orange VA, so we have a lot of minority patients, a lot of patients who have comorbidities. And it was very hard trying to manage all of that. And, we had to make a lot of tough decisions, and a lot of which still haunts me to this day, because not knowing whether or not you were doing the right thing, do you let someone stay and fight, give them a fighting chance, or do you let someone who's new, who just got, this diagnosis, get that ventilator? These are the type of decisions doctors are making. If you have 20 ventilators and you have 21 patients, who gets it? And for how long? How long do you let them try to survive? To the point where if you were not making progress, nor were you getting worse, the conversation we start having that conversation. Well, this doesn't look good. because someone may come in and they might actually start getting better if we give them those resources to them. So these are the conversations, these were the decisions doctors were making. And it was not, I tell people, people say like, when all of this is over, we will look back. I do not want to look back. It was tough. I mean, Felicia, I think, can attest to, we've had conversations, heartbreaking moments. But I am so happy to see that we're coming out on the other side of this. We'll talk about that, I guess, a little bit more later.
Thank you, Dr. Oyetunde. And we will at some point come back to kind of the psychological impact that weighs on us as women of color, and as the people who typically are the burden sharers and the fixers when you can't fix it. Right. So this has been a gut-wrenching time. And I can speak for Tolu because she and I had conversations in those tough moments. And it was hard to keep going. So while we're getting in a better place and people want to put this behind us, this is very real. It's very present. And we are all still dealing with the impacts of it. Johanna, can you talk to us and introduce yourself, and the same, talk about the impact of COVID-19 on your work. And I imagine in the communities you serve, it's been profound. So please share.
Of course. Hi, everyone. So yes, Johanna Calle, Senior Policy Advisor with the Office of New Americans in the Department of Human Services. And I was telling folks before we started, I actually started in my role in April. So it was right as the state was shutting down and we were beginning our life under COVID, when everyone thought it was going to be just a couple months, and we're here still a year later. And the Office of New Americans really was created before I started, and the goal was really to focus on the fact that immigrants and refugees really are part of our state, and we have to focus on ensuring that our services, our programs are accessible to these communities, that we keep them in mind in all the services that we have available to all New Jerseyans, right? And when immigrant New Jerseyans thrive, we all thrive. And that's really what the focus is for the Office of New Americans and for our work. And when I came on board, our hope was to really hit the ground running, work on initiatives and programs for these communities, and really thinking big picture and all the different goals that our governor had set in creating this office. And then COVID hit. And so really everything sort of shifted to how do we support immigrants and refugees in this pandemic. We understand that immigrants and refugees are essential workers. Many of them are working on the front lines. Many of them are in jobs that put them at risk more than any other communities. Obviously, there are challenges in accessing services, in fear of government, fear of all the different things that sort of, it's a perfect storm for communities to become particularly vulnerable. And so one of the first initiatives I was working on was actually working closely with our colleagues at the New Jersey Department of Health in supporting their efforts in doing outreach to immigrant communities. My background is working in immigrants' rights advocacy. I know well how many community-based organizations, service providers, and others have the trust of the community. And it really was about keeping an ear to the ground about what was going on with the community, and at the same time thinking through how to support them. So in terms of what we saw, that I think is just important for us to be mindful of is obviously that fear. I think there was a lot of misinformation at the beginning, a lot of fear, a lot of mixed messages about what was safe and wasn't safe, right? And how do we make sure that we get the right information to the community so they could stay safe? Also, how do we help the communities make it through the pandemic, not just on the public health side, but also on the economic side? And how do they get through the difficulty of that? And I know we're going to talk about that a little more later on, but those are the constantly hearing those challenges to figure out how the state could support various state agencies that have those services, and also how do we make sure that the communities know that they're available to them.
Thank you, Johanna. And I can imagine, like Tolu, there were moments where you couldn't meet a need. And how do you sit with that personally when you know somebody is hungry or homeless or doesn't have what they need, the basic needs? So we'll look forward to unpacking that and also, again, the psychological impact of that survivor guilt that we have and those things. So now I want to shift to who I'm calling Auntie Kim, but with deep respect, to Kim Nesbitt Good, to talk with us. I'd like for you to share just a brief intro of you, and then your perspective on the impact of COVID, because you have seen the worst of it. And you have seen people in their brokenness, not being able to come together and celebrate a life in the ways that culturally and traditionally we'd like to do. So I want to hear from you, and well, I'll just stop there and let you share with us what you have.
Well, first I want to thank you guys for this great opportunity. It's been rough. It's just something that none of us ever thought we would see ever, nevertheless in our lifetime. And to see the impact that this virus has caused our country.
Yeah.
Someone asked me the question today, do I ever feel angry? And I do, because I see this virus being something that really did not have to be this bad.
Mm-hmm.
If we were just informed.
Yeah.
And you can't sugarcoat stuff. It is what it is. The mark was missed on purpose. And we're talking about how it has affected our Black and brown communities. And as far as I'm concerned, that was done on purpose so that we wouldn't know what was going on. Unfortunately, it has affected every community, every race of people. I never thought in our funeral home, which will be 89 years old this year, and as blessed as we are, I never thought that in my establishment, I would see 42 bodies at one time. Can you imagine? They don't even have ICU units that can hold 42 patients at one time. It's been horrible. And we have to pay attention. We have to help one another. We can't sugarcoat the truth. This did not have to be this bad. But with so much ugliness towards Black and brown people. So it's not just affecting us. It's affecting everyone. But through the grace of God, through the support of the community, our councilwoman, I want to thank our mayor and other elected officials throughout Union County and throughout New Jersey. I want to thank our health director, Krishna Garlick, in the city of Elizabeth. We alone, I alone, have sent them over 200 names of people to be vaccinated, where people were calling the funeral home to see where can they get the vaccination. But God is good. And I don't care what you do and what we do, we have to stay focused. We have to stay focused. I am so happy to be on this panel with these amazing women. And for the Rutgers family, for what you all are doing. Because we have to talk about what's going on. We can't pretend. Do you know what it's like to sit with a family and they tell you they have not seen their loved ones, and their loved ones had to die alone. Can you imagine sitting with a family and this death was so unexpected till they have no means of what they should do? Can you imagine people ringing your doorbell, asking you for help because their loved one is dying and they don't know what to do? It's just unreal. But we have to stay focused. We can't be caught off guard because that's the plan. But God is good. And he's going to bring us through this. But we have to stay focused.
Thank you so much. What you shared was just incredibly profound, and it made me think of something, and I'm just going to put it out here, and then we're going to move on and introduce the other panelists. But one of the questions we're going to come back to is this whole notion of failures of government, particularly at the federal government level, and then also what we do to ourselves as communities of color, as Black folks. Because I don't know if you all remember, but at the beginning of all this, the rumor was Black folks can get COVID. Remember that one? And then it turned out, who's dying? Oh, it's us. So it's sometimes our lack of understanding and education can contribute to these myths that encourage some of us to take risk. So we need, if we're going to have girl talk, we're going to put a pin in that and come back to that later too. Ari, you want to take us?
Yeah, and I want to just say already so many insightful answers, and I really want to say, Miss Good, thank you so much for giving us your insight, because I know that's something that has been very realistic for a lot of people, especially not being able to see family members during this whole pandemic. That has been something very scary. But the fact that you have been strong for so many families as well shows your strength in all of this as well. And that gives people, just a strong shoulder to lean on in all of this. As little as that might seem to you, I know that's more impactful to a lot of people themselves. But moving on to that.
Ari, I'm sorry.
Yes,
Before
it's
we
okay.
do that, I just realized that we did not have the councilwoman introduce herself. So can you
It's
make
okay.
sure? Thank you. Apologies. And grace expected, hoped for.
Okay. Good evening. This is so impactful for me. As a councilwoman, it's like it stops with us. It's like we're the bottom. We're the people constantly call, text, looking for answers. What struck at my heart the most was how we treated our seniors in the nursing homes, and to advocate very passionately for residents who had their mothers and their fathers and their loved ones in nursing homes in Elizabeth, really hit my humanity. 86-year-olds and 90-year-olds and 92-year-olds. And I'm hearing stories from, residents that said, one day I visited my father or my mother, and then the next day, 2 weeks, when this happened and everything shut down. And then there were so many deaths in the nursing homes because of COVID. And it was unreal. It was extremely unreal. And in Elizabeth, in my own town, we had 2 particular nursing homes that had multiple deaths, like 15, 16, 17 people who died of COVID. And And me, the government, I'm the local, I'm a part of this. This is the government shutdown. And the state of New Jersey shut down the executive orders and say we couldn't go inside the nursing homes, and loved ones no longer see their loved ones in nursing homes. But how are they getting COVID, and how are they dying from COVID if family members are not the ones who are doing it? It was just such a dark period. At that time, last March, April, May, Mother's Day coming around. People want to see their mother in nursing homes, and they couldn't get to them. And they're dying, and then they're having the bodies, of people, loved ones, just stacked up. It was just an unreal time until we all had to just get a grip. And we had to just take a deep breath and say, okay, how are we going to do this humanely? How are we not going to allow our elders, and that's very dear to African American and people of color, Latino families, how we treat our elders. How are we going to deal with that, with them being by themselves? We've been taught to love and respect our grandparents and our great grandparents. And here we are saying, okay, only the elders are going to get this. If they're going to get it, then why aren't we doing something to protect them? And so that was a very challenging time for my spirit, from the way I was raised in the church, respecting our elders. I've always been taught to respect those who have lived 70 plus years, who lived the golden ages. And so it was very difficult, but we passed that now, thankful to God. But there've been so many issues in terms of the government. I'm glad to say that my mayor here in the city of Elizabeth, we never shut our public building. We never closed City Hall. And I say that with great conviction, because the storm that we were all thrust into, some of us did not become uprooted. And in Elizabeth, working with people like him, Nesbitt Good, dealing with the families, and being proactive when the vaccine made itself available. In Elizabeth alone, we vaccinated over 16,000 people. And 50% of those people were Black and brown people. And so we've been working locally to make sure that we weather this storm together. We say things like Elizabeth strong, and we have to weather this together. And our health director, I give her much kudos, Krishna Garlic, for all the work she has been doing in terms of testing and making sure when the vaccine first came out. I mean, everyone just joined in, our faith-based community, our nonprofit community, everyone just jumped on board to get as many people vaccinated as possible, especially our seniors, who were the most vulnerable, quote unquote, population during this whole pandemic. And the myth that African Americans are not going to get this, I don't know where that came from. And it was just, it was just the work of some mass confusion, because we all could not believe what was happening. We all could not believe that people were just dying, walking into hospitals, and then the whole hospital situation in urban centers. We all know that situation. A lot of hospitals closed down in urban centers, and they merged. And whether you look in Plainfield and Elizabeth, we had 3 hospitals. Now we have 1. So, and meanwhile, our populations are growing because we're welcoming in First Americans, and they're coming into our cities. So look at all that's happened. We closed so many hospitals in Elizabeth and Plainfield and Newark and East Orange. So where do our sick go? So the hospitals, they were inundated with people. So it was just something very, very unreal that we had to deal with. And then the food insecurities. So the food insecurity. So it's a lot. And I'm just thanking Rutgers, my alumni for just doing this. It does my heart good. Miss Karima, I'm just so proud of her. I remember her as a little girl, and this is what the legacy is about in terms of her story. You know, I look at Kim, and then Kim and I look at Karima, and then all this brilliance, you know, on this panel. I just want to sit back and learn, and let's just say that we're all in this together. It's like a test tube type of thing that's happening, but we're living it. And so we have to make sure that our stories are told. The story is told correctly. It's her story. It's historical, but it's her story. And we have to tell it. The mothers who have to go out and work and try to protect their children. I have women call me all the time. Their husband left them. They just had a 2-month-old baby and they got 4 kids and they're crying. What should I do? Should I send my children back home? No, don't send your children back to another country. Keep them. You just need child care. This is where I'm at. You just need child care, or you just need food. Come on, we have some food pantries. I can get you some food. You need Pampers, but you don't need to send your children away. I can hear it in your voice. That's not what you want to do. So it's heart-wrenching for the local persons like myself and like Kim and others who give up so much of their time, like Mayor Bo, which gets on every single night and literally says the number of people who were infected and the number of people who's no longer infected with COVID and how many passed away. He does it religiously because he wants the people to know that he cares about every person who gets sick, who dies or whatever. And so that's where I'm at. And I'm just here letting you know that the vaccine, I don't care which one you get, it will help. I don't know if it's a cure or not because I'm not a doctor, but I know it has some qualities that will probably prevent you from dying, quote unquote, or going into a hospital, quote unquote. Who knows? But I'm happy that my residents, over 16,000, you know, thus far have gotten the vaccine, and that is the Moderna vaccine. I mean, we've been working it every single day, Saturdays, and now I believe on Sundays, we are available to do the vaccines because it's so important that people try to vaccinate themselves from whatever these mutations are going to be going on. We just don't know.
Thank you, Councilwoman.
I know I talk a lot.
No, but you're.
I'm a Baptist and a politician, so you're gonna get a whole lot of conversation.
I'm with you. I love it. A Baptist and a politician. That's a combination. No, but your story and what you shared is so powerful. And for me, there were like probably 2 key takeaways, and one is our obligation, what we know as women and as women of color, in terms of our respect for our elders. And how we want to prioritize the health and well-being of our parents and our grandparents. And that struggle is real. And some women are in that sandwich generation where they're caring for young children and they're caring for elderly parents. And the bottom line is that we often just have those responsibilities to shoulder, and it's difficult. The other thing that I'm taking away from what you shared is really this notion of community, and that community is what gets us through hard times. Community, when government works, when it's really community-based, right? That's the difference. When there are people who are working together for a common cause, when the politicians understand and care about the community and are really invested in the community. So for me, those are some real themes in terms of what you shared that I think are moving and poignant and going to help guide us as we have some additional conversations. So why don't we pivot now to Dr. Sill? And ask you to share with us. Did I pronounce your name right? I can't hear. Oh, unmute. Sorry, that's what.
Yes,
Okay.
yes, you did. Hello, hi, how are you?
Hi. So we'd like for you to introduce yourself and to give us a sense of how COVID has, the impact of COVID-19 in your work and the kinds of things that you've been doing.
Okay, so my name is Marcia Still. I'm a nurse practitioner. And as Arielle mentioned prior, I was the director of nursing of a long-term care subacute facility. And I think, and I know I hear all these stories and it's all coming back to me because I've tried to like throw a lot of it behind my, just in the past, but really was just a year ago that everything started. But I think, as you mentioned, the nursing home with the patients who are elderly, they were really so fragile. And, there were families that used to come every day and now they can't come. Yeah, I think a lot of the patients, I don't know if it's so much COVID that they expired from, then I think more heartbreak from not seeing their families. Because we had a Korean, our building had a Korean population and the families were very involved. They were there all the time. And all of a sudden now we had to shut down and we were doing even window visits. We're not even like, it's just the human touch was not there. And we, the healthcare providers or the healthcare workers in the facility, it was such a lack of staffing. I mean, no nurses at one point, no nursing assistants, those are the ones that touch the patients every day. They have that intimate care, that they would provide to the patients. And to see that, I think there are times when I was there till almost 2 o'clock in the morning and I would get in my car and I would just start crying, like Englewood Hospital, we sent a lot of patients if they had any change in their condition, but there were times they were telling us, no, we can't accept the patients because there's just no room. Holy Name was the same. The EMTs, the police department would not come in. We had patients who were full code and we're just like, what do we do? And it was just so traumatizing for me. And I'm sure for the staff, I mean, we had to hold hands, and try to figure it out. Masks was another thing. I mean, there were guidelines that we were just like, well, what is it? Is it N95s or is it just plain surgical mask? And then there was a time when we didn't have enough supplies, for the staff. So they were, it's now I'm seeing more of being on this other side, talking to patients who gone through it themselves, like had COVID or had families that had COVID or, that expired from COVID. And I'm seeing more of depression and anxiety, more anxiety than depression. And with the social isolation, we're human, we're like social butterflies. So to tell us, hey, we can't do this, it's still traumatizing for me. It took me a good three weeks to actually sleep without jumping out of my sleep by having a panic attack. I just remember doing CPR on patients who I knew were no longer there, but just because they had a full code status. But I'm still trying to work through it. I do talk to someone about it because I think it's important for us. I mean, we're not Superman and Superwomen here, we're human and we're trying to help as much as we can. And even our whole household, I would even touch my children. I wouldn't even talk to them when I come home because I didn't know what I was bringing home to my family. But the patients, at the end, at least I felt like I had to hold their hands before they passed away. If it's the last face they saw, I made sure that someone was there because the family couldn't be there. FaceTime was we used to FaceTime and Zoom. It just was not what it needs to be. And I wouldn't, I hope we never have to go through this ever again. And I know I didn't get the person who mentioned how the government, we were trying to figure it out and we were told, no, don't do this or do this. And I felt like it was delayed a lot. I think New York even shut down their borders long before New Jersey decided to. I'm like, what are we waiting for? And it just hit. When it hit, I mean, I never forgot the day. It was March 24th of 2020 when my first patient in the building had COVID. And it was just downhill from there. We had about 60 staff members total with COVID, and it was just one person was out for 2 weeks and we come back another person. So it was never full staffing. So, we had to figure it out on our end. And in the funeral homes, oh my goodness, to come and, take the patient, the patients out. They were just, we were booked. We just can't. We had patients there waiting for days before they could get transferred to a funeral home. And then also the funeral itself was just so dehumanized. They don't even have, family there. They're just told, we just have to do this. A lot of cremation still happening now, but a lot more back then. Not being able to see your loved one in a hospital, before they pass away. That still sits with me. And it's something that I said I would never wish on us ever again. I hope that this time, anytime it would be more prepared than what we had. I had COVID in January 2020, and I only knew because I did the antibodies test later on, but I was very sick in January, and God knows where I got it from. But I just know that I've had also complications since from COVID. So I know there are a lot of patients that are going through not only anxiety, there's autoimmune disorders that have presented since COVID, asthma, people who had asthma like from baby are now having a lot more episodes of so it's brutal. It was brutal. Yeah.
Wow. Thank you for sharing. These are powerful stories of just gut-wrenching experiences. So thank you. And I'm glad you're here, and I'm hoping for your continued good health. Ari's going to kick us off with the next question, but thanks everyone.
Yeah, I'm so excited. Thank you again for everyone who joined this panel and just this conversation. But moving on and talking about the pandemic, and I know each of you guys have seen the impact coronavirus has really had on everybody. But I want to know from each of your perspectives, as all of us women of color on this call, I know we've heard myths affecting our communities about why not to get the vaccine, why we should get the vaccine. So I want to know from your own perspective how those myths have really affected you guys in your place of work. And just some advice you guys can give to people, the importance of getting the vaccine during this day and age. And Marcia, I'm going to start with you again, because I know you just asked your question.
COVID vaccine. Okay, so everybody's individualized. You can't, I hear a lot of patients come to me and they said, one of my friends told me, or I saw it on the news that, the second dose is worse than the first and they got sick and, a lot of people died. So I tell them, I look at their history, like what are their conditions, if they have chronic conditions like diabetes or hypertension, heart disease, asthma, any kind of respiratory illnesses, and you talk to them about the reasons why you should get it, because it is important, to protect yourselves. I'm telling you the aftermath of having, seen patients come in with lupus, or any skin disorder from autoimmune disease and asthma. So I'm saying, would we rather take, a shot and have a tenderness for like a couple of days and maybe feel a little tired than take it? But I do recommend that we get the patients, get the community vaccinated, because it'll only help. What's happening.
Anyone can answer next. I want us to
I just want to just echo Dr. Seal's comments. It will help. As I stated, in Elizabeth, with the help of so many community leaders, we've gotten well over 16,000 people vaccinated, and the number is counting every day. So we just, there are myths always about the whole vaccine scenario in America. Has a long history about doing some things to African Americans and other groups, ethnic groups, when it comes to medicine and vaccines. And so all of those historical issues are correct in terms of what they did. But however, as we move forward, people need to realize what is happening today with COVID-19 is everyone is being, affected. It's not just one group. Everyone is in line getting the vaccine. You don't have a set of vaccines for this person and a set of vaccine for that person. everyone to collectively, people are getting vaccinated. Out of the 16,000 that the city of Elizabeth vaccinated, 50% were of color. So the other 50% is of the dominant race. So that tells you right there that it's the same pool of vaccine that's being used on everyone. So the myths, they there, but it doesn't have anything to do with what we're dealing with now in terms of protecting ourselves. It's like, it's either, and I hate to say it, but like Kim said, it's either life or death. We got to speak truth to this. And we've seen enough death with this COVID-19. So I think the vaccine helps us to choose life, to prolong life. And I think that's what people like myself, Kim Nesbitt Good, Mayor Bolwich here in the city of Elizabeth, our health director, Krishna Garland, I think we all realize that we want to prolong life and diminish how many people die from COVID-19.
Okay, I can jump in as well. So some of the myths, in the beginning, it was African Americans can't get COVID. And, a lot of people, that actually hurt our community because a bunch of people did not come into the hospital because they didn't believe that they had COVID. So, even if they did have a fighting chance, they weren't coming in until symptoms were, to the point where their saturations were below normal levels that they immediately had to go on ventilator. So that was myth number one and how it hurt our community specifically. Myth number two, I think that it's almost a catch-22 because yes, we've had the Tuskegee experiment. We've had the use of Henrietta Lacks. We've had, our Black and brown brothers and sisters being used for years, centuries, as guinea pigs for science experiments. So I truly understand the skepticism from our community. But I will also say that that same skepticism can be what could kill us. I think that skepticism right now is what's keeping people from being vaccinated. So there are two narratives right now. It's the narrative that Black people don't want the vaccine. Well, I think that narrative might actually is being pushed by people that are actually not even in our community. Because, our community right now, if you look at it, there were people trying to get the vaccine that could not get the vaccine.
Oh, you
vaccines that were allocated to our communities that did not make it into our communities, especially if you talk about the Pfizer vaccine, which first came out and had to be refrigerated, and they had to be, care with these vaccines that we just couldn't get in our community. So now they have the Johnson & Johnson vaccine. That's a 1-dose vaccine, but now there's another myth that it's not good enough for our community. They're giving us the second-hand version. All of the vaccines that are out right now is doing one thing. It's keeping people from dying. 95 to 99% will keep you from being severely hospitalized and dying. That is what I care about. Now, I'll tell you right now, I got the vaccine. I got the Pfizer vaccine when it first came out. And Felicia and I were having this conversation that before I got the vaccine, my mom was like, no, you're not doing this. My mother is a nurse, and she was very against it. She was like, because frontline workers got it first. So my department, we are the people that put the tube in. We intubate you to put you on the ventilator. So we are in your respiratory airway. So we were the first ones in the hospital even to get it. I think I got one of the first doses that were available to the Temple anesthesia department. And I had to have that conversation with my mom, my own mother, who knows, my job and was very against me getting this vaccine. The big one was my reproductive system. There was this myth that it was going to make me sterile.
Okay, come on now. This is the question. There
was this myth. Oh my God, no. Now I have not tried to have babies yet. But guys, the way I put it this way is if your presidents and your doctors and your frontline workers are all getting this vaccine, they can't want to kill us all off, like all of us of every single color, men, women, Black, non-Black, you know what I mean? So I had to kind of walk my mom into that talk and come out with the facts and the numbers. Like, Mom, listen, no one's had this. These are the symptoms that they have had. No one has died from this vaccine. There were one or two allergic reactions, but no one has literally been died or no one got COVID from the vaccine. That is another myth that, getting the vaccine can give you COVID. The vaccine does not actually have any virus in it, like zero. What the vaccine itself is just an mRNA, like it's a protein that they put, and basically your body has a messenger system that kind of makes this protein. So your body can then identify it as foreign and create those antibodies to it. So getting the vaccine doesn't give you COVID. Now, I will say this because, this is real talk, right? We're not lying to each other here. There are people who have had harder times with the vaccine. So they're body aches and they're in the bed for a day or two and they have chills and they have fevers. I had chills and I had some soreness. Some people had some brain fog as well. They were a little woozy and foggy for a few days. But I always say, if this is what the vaccine is, and that wasn't even the virus, imagine what COVID would feel like. Imagine what it could do to you, not even yourself, but if you get it and pass it on to someone whose body can't fight it. So there's so many myths, but everything, the benefits really definitely outweigh the risks. And these myths that people are putting out, I think, is really affecting our community because our community is already so skeptical about, getting vaccines and especially new medical advances because we were used so long, as the scapegoats and guinea pigs to test some of these things. But I really, truly want to say that I don't want them to use that same weapon against us. And now we are seeing people dying in our community when it is being offered to us. That is going to be them winning again. They're see, we even brought it to their community. No one got it. It went to waste. Let's stop allocating it to them. And then when we find that it is important and we do need it, we don't have it there. So it's so important for us. It's so important for us to, understand our fears and understand where it comes from because they are valid. They are real. They are based in history, but also not letting some of that keep you from actually living, keep you from, your grandma, your grandfather, the elderly, the sick in our communities from making it through because they are the vulnerable, and our community also has a lot of the comorbidities, a significant disproportionate amount of some of these comorbidities that make it harder to beat this vaccine. Renal failure, pulmonary failure, COPD, asthma, it's so prevalent in our communities that we have to take extra care. So this vaccine, I think, is when we're all saying this, our chance to fight and to win, and understand that it's okay to be skeptical, but I think that we have to then start using the facts. Yes.
Okay, so let's just.
Sorry, can I jump in actually? Because
Sure,
there's
please
a
do.
myth there's a myth that I've been hearing lately that we heard from some stakeholders and community leaders that folks don't feel comfortable selecting demographic data when they register for the vaccine, or they don't want to share their race or ethnicity in the information that they have to provide. The myth is that if they put that they are Black and brown, maybe they'll be put in the back of the line for appointments, or they won't get appointments, or they'll be targeted differently to get the vaccine. So I just wanted to highlight that because unfortunately, I think folks get a little weary when they start asking us for our race and ethnicity, right? Folks of color are distrusting of the government. We understand, there's a reason why, as we all heard of the reasons why folks could be skeptical. And so it would be good for folks to know a lot of the reasons why the CDC and the Department of Health here in New Jersey are asking you for that information is to help ensure that folks are having access to the vaccine. It's to help make sure that we are targeting efforts to our communities to make sure that our communities are having access. The governor announced and our Department of Health announced at the beginning of the month a whole rollout of FEMA sites that were done at local communities, at churches, and at faith spaces, so that folks felt more comfortable going to those places. And they're specifically to do outreach to Black and Brown communities and vulnerable communities. But the only way to really make sure that we're allocating that correctly is to see that folks are getting the vaccine. And if folks are not checking that box off and letting the state know or letting the CDC know where your demographics are, it's going to be a lot harder for us to make sure that we're being counted as well.
Awesome. Thank you. Thank you so much, Johanna. We've got the Q&A popping, but I just wanted to riff off of something that Dr. Tolu said a few minutes ago. So full disclosure, I live with my 77-year-old mother, and we got our second dose of Moderna at our church on Sunday. And yesterday, I was laid out for a minute because it just, that was the way my body was responding to it. I had some fatigue and, a headache and all those things. My 77-year-old mother, no problem, taking it like a champ, downstairs making breakfast. I'm like, feeling like I'm hungover. So I will just say from my experience, it's okay. And 24 or 48 hours of a little discomfort, no problem. But I do think that we need to educate ourselves and get the facts. And I will tell you that I've had conversations with my 40-something-year-old girlfriends who've told me I'm not going to get the vaccine because it's going to make me sterile. And two things. One, you're not having any more babies anyway. Two, come on. That's not exactly what we know. So again, we have to move from myths to really trying to get facts. And I appreciate that some of the people are putting in some questions in the chat box. So we'll come back to those too and try and cover some of those as well. But Ari wants to ask a question and I'm yielding the floor. Thank you.
Great. Okay, so I know we have the Q&A box, so I want to make sure we have time just to answer some of them. So ladies, if you have any perspective from your different communities, that'd be great. And then from there, we can talk from there. And I want to start off also with Ms. Good with this question, and then anyone else who has more insight, you guys can jump in as well. So Ms. Good, with many of the barriers Black people have faced, mistrust in health community, mistrust in health literacy, all of that, what are some tactics for you, especially you being in the funeral business and all that you feel can help solidify comfort for people coming not only from the hospital, but when they're coming to burying a loved one? What are some tactics that you have given to a lot of these people, especially in the African American community, of comfort in the midst of this pandemic?
Okay. Well, I don't know if Karima shared with you all, I'm dealing with breast cancer. And I asked my surgeon and my oncologist if I should take the vaccine. And they said, you're not going to just ask me if you should take it, you are going to take it. And I've had different cancers. This is my third type of cancer. But we have to make sure that people understand that the vaccine is real, is going to help us. When I see a family, it's so sad because someone mentioned about when you went to the nursing home, how we couldn't let the families in. It's the same way here at the funeral home. So when we bring a family in, we're limited with the number of people that we can bring in. But then we have to explain to them, the CDC guidelines and the state guidelines that, we can only have a number of people. You're not supposed to touch your loved one, even at death, and it's difficult. But we have to just keep doing what we have to do and be willing just to spend whatever time you need to spend with your families. Just spend that time with them, because you're going to be answering questions, or we have to answer questions to them that our doctors didn't answer or couldn't answer. When people ask us, what does my mom look like? I haven't seen her in 3 weeks or 3 months or whatever. So all we can do is try to give them as much time as they need to ask us whatever questions they need to ask. Sometimes we have to even call a doctor and say to the doctor, well, can you tell me, did they suffer? The family wants to know. Did they suffer? Did they cry? Because I understand, I don't know, those of you who are in the medical profession, they were saying that the people that are on ventilators, just before they pass, they shed a lot of tears. Is that correct?
Sometimes sometimes it's just the body's like natural response. Like you will tear. The thing is, I can't say whether or not it's because they know what's happening. But usually if they're at that point where we're saying or it's like a medical, like they're transitioning because of what's happening, usually they're on the ventilator. We have medication that keeps them comfortable. But there could be some tearing. Now, I believe it's just like a natural body response. But some people may say it's them who, like the patients know it's their time. A lot of these different things are being said, but I think that you see that more on the patients who are not intubated, they're off the ventilators, they kind of understand that their time is coming and they're breathing really hard, or right before you make the decision to put the tube in, they understand that they might not come off of it. And that is sometimes the hardest thing. And to have to use FaceTime to have a family member have that moment is hard, because I'm holding the phone and I'm watching this interaction and I barely can keep it together, and I don't know these people, but yes, sometimes, especially when it's that moment and they were calling the family asking them for permission to put them on the ventilator, it's almost like the patient and the family member kind of have this feeling that that's gonna be it. So that's usually where I see the tears, not as much so while they're intubated and sedated, because they are sedated, but there are tears that do come out of them. I just can't say what it is. I think maybe the spiritual side of me will say, that's the body knowing that it's time. But the medical side of me, I'll say, that's a side effect of the medication, because I can't tell. And I don't think my heart wants me to think it's the other anyway. It would be too painful.
It's a frequently asked question.
Wow.
That I want to say, we keep talking about the numbers going down. We are still burying at least 3 people a week, our establishment, of COVID. Don't let your guard down. And those of you who think that this vaccine was created not to help us, that is definitely not true. Look at the number of white folk going into our communities to get it. Now, we talking girl talk and real talk. Pay attention to what they are doing. They're going to get the vaccine. We have to think and pay attention to what we're seeing, because there's more of them running into our community to get what belongs to us. A young man asked me yesterday, Miss Kim, do you really think I should take this vaccine? I said, well, you have 2 options. Take the vaccine on my business card. The choice is yours. And I know that sounds mean. I know it sounds hard. And I know it may sound cold, and that's what I'm not trying to be, any of those things. But we have to take care of one another. And if this is gonna make him understand the importance of taking this vaccine, then I hope he heard what I said. God needs no help from us in not doing what we need to do to save ourselves. None of us are here to stay, but he doesn't need our help by us not doing what we need to do for our health and our well-being. We don't do walkthroughs in our funeral home because you know as well as I do, people who are asymptomatic shows no sign of having the virus. People don't always tell you or even know that they're positive. A temperature check is not going to always tell you that that person is positive. We have heard in our industry of people going to funeral homes for wakes and funerals and signing other people's names because they were positive and didn't want to be traced. It's real, guys. It's not over. Even though the vaccine is going to help us, I had the vaccine, my whole staff. We have to take care of one another. If anybody's ever in our neighborhood, across from our funeral home, we have a COVID memorial garden. When we first opened up the garden, we put 250 bags out. At the time, the death rate was 230,000. Look what it is now. People are still dying from COVID. So just because you get the vaccine, what I'm saying is, does not mean you have to stop taking precautions. We have to continue to wear our masks. We have to continue to wash our hands. We have to continue to social distance. You cannot let your guard down yet. But at least, as the other young lady was saying, if we get the vaccine and we get COVID, we won't suffer as bad with it. We need to pay attention to the scientists and not, you know, the last man that was in office down Washington. Let's be real.
Aunt Kim is full of wisdom. Thank you. And you said something that I think we should just delve off into. I want to unpack it a little more. And that is the notion. We talked a lot about vaccine hesitancy and the reason why we should take the vaccine. But let's talk about after taking the vaccine, because she made a good point. It's easy to get this false sense of security that if you've been vaccinated, all good, go down to Miami, get arrested, whatever. But people are interpreting what the vaccine could do and maybe forgetting what we still need to continue to do to stay healthy. So I'm going to ask one of our medical professionals maybe to respond to that. And then Johanna, if you want to also talk about, you know, from the state perspective, how you all are addressing that, that'd be helpful.
I don't know if Ms. Phil is still on, but so research is still being done to kind of tell us what it means for us when we have the vaccine, when it comes to transmitting the virus. We know that if you get the vaccine and you do come in contact with the virus, it protects you 95 to 99% from being seriously ill from it. That doesn't mean you may not still experience some symptoms. It's kind of like getting the flu vaccine. You may still get the flu, but it won't be hospitalizing you. It would be, you'd be at home in bed. Now, I read a paper not too long ago saying that the Pfizer vaccine apparently may be protective in transmitting the vaccine, but more research still needs to be done. So until that comes out, until we have information, and until we have solid data about what it means about transmitting the the virus, we still have to practice social distancing. We still have to wear our masks. It still has to be the same kind of way. That doesn't mean, you can have a gathering and say we've all been vaccinated, we can all go to the club. No, that's not what getting the vaccine means, because what could happen is you can still contact the vaccine. And if your neighbor has not gotten the vaccine yet, or has a compromised immune system, you can still give it to her and you will be completely fine. So honestly, this virus really, for us to get through it, we really have to have a sense of community, especially our community. We really have to look out for each other, because we want to go back to having these gatherings and celebrating life the proper way, and the way that we want to, and celebrating monumentous moments. But we still, all the data shows us that we still need to wear our masks. We still need to quarantine if you feel like you have symptoms or if you test positive for COVID. Because even though you may not get sick, you can pass on that virus to someone else who can, be seriously ill. And no, social distance rules do not now suddenly go away because you've gotten the vaccine. It protects you, and if you are in a group with a whole bunch of people who have been vaccinated, it does protect you guys, but it doesn't protect those that you might go home to. So I think still our rules, even at the hospital, is we still maintain social distance, even though we are all the workers are vaccinated. We still have, no close quarters, no things like that. We have to still abide by those rules until, the science tells us it's okay. And right now we haven't gotten that yet from any of the vaccines.
Thank you. Thank you. So before we go, Dr. Sill, if you can hear us and are able to respond, the question was around, post-vaccine and what you think we should be doing as well.
So, vaccine, no vaccine, infection control has to be like the highest priority. And I think that a lot of times people let their guards down, period, without even being vaccinated. But I have seen several patients of mine actually coming back to get tested for COVID because, and after the vaccine, have tested positive, although the symptoms are not as severe as it would be if they didn't have it. But there are still cases that are coming up positive. So I do tell the patients, like I do antibodies testing, like for most of the patients that come through the door, they don't have symptoms, I still test. And quite honestly, 90% of the patients have antibodies, which means, and some of them did not even know they had COVID. So I tell them, like, just because you have the antibodies and, the index level is high, you still want to wash your hands. You still want to wear your mask. And one of my pet peeves is when patients come in with a mask under their nose. I'm like, what do you think is going to happen if you don't wear your mask over your nose? It can be transmitted through, so I tell them, I'm not seeing you until you put your mask on properly. But it is, it is very important to stress that 100%, not just Purell or, the generic hand sanitizer, soap and water for at least 30 seconds, to really wash your hands in between. And even if you think they're clean, just wash your hands. And I know that, with me taking the vaccine, and I did, I still am afraid that, I can get in contact with somebody, one of my patients who can come in and infect me with COVID again, so it does protect you, but only to some extent. It's like the flu vaccine. You could still get the flu, but you just won't have as severe of symptoms than you would if you didn't have, the vaccine.
Thank you. Perfect. Joanna, I'm going to ask you to give us your thoughts too.
Yeah, and you know, I'm not going to speak on behalf of the Department of Health. They are really the experts, and obviously we have public health workers here who would know much better than I am. Not a doctor, but I will say that I think from the state of New Jersey's perspective, and really what I've heard even from our governor and our commissioner of health, is the goal is to vaccinate folks, right? Because this is it's a running clock to get folks vaccinated so that we can stop the spread, and that's really where, you know, you have an issue of supply, because the supplies are not there to be able to vaccinate everyone. But as the supplies increase, and I'm sure all of us have experienced this, where months ago folks were looking for the vaccine, were having a hard time getting even an appointment or even get vaccinated. And now we're seeing a lot more folks getting vaccinated because the supply is increasing, right? So I think what I would say is, as a way to prevent this, obviously follow the public health guidelines of protecting yourself against the virus and still washing your hands and wearing your mask and all those protections we have to take for us until we are all safe, until everyone is vaccinated. But until then, also is understanding, if you are eligible for the vaccine, then go ahead and get that vaccine. And I think, you know, there have been questions about which vaccine do you get? And I think everyone has been saying, just get the one that you can get as soon as you can get it. And so I'm gonna actually drop on the chat the categories, because I think what folks often, you know, and I think, you know, Tolu, you said that, you know, we're concerned about folks. There was a narrative that Black and brown folks just didn't want the vaccine, and not sure whether that narrative is real. And I think we're seeing a lot of folks who want to get it and are trying to figure out when and how. And so that list should give you an idea of when you'll be eligible, so that at least you know when to get it, because obviously we've had to roll it out in phases because of the supply issue. So that list should give you that. And then I'm also going to drop a couple other resources on the chat for folks. And I'll plug the state website go to the Vaccine Hub if you have questions, because they have a wonderful team of folks who are trying really hard to answer all the questions live all the time, and they're updating them. So you can literally ask any question if it's probably there.
Thank you, Johanna. And Councilwoman, we're going to let you give us a last comment as well about your thoughts post-vaccine. And just real quick, because we're going to wrap up, but thank you.
I understand. I just want to piggyback off of what Joanna said, that people do want to take the vaccine. I get calls every day, texts, you know, where can I sign up for the vaccine? So the more information we get out in terms of what is available and where the vaccine is available, I think it would be better for our brown and Black communities and communities of color all across the state of New Jersey. So some of the myths have really been broken down, and I'm believing that we're getting the word out that the vaccine is not a cure-all, but however, just like the flu vaccine and all the other vaccines, you may get something, but it's not going to be to the point where your health is and your life is jeopardized. So whatever vaccine works for you, please take it. Please get it. Contact your local health departments, your county health departments, your state health departments, you know, bug people about getting yourselves and your loved ones on a list to get the vaccines. And thank you again for this wonderful time. And we just need to keep this going, because it's not just her story in the month of March, it's her story every day, 365 days out of the year. Thank you again. You've been such a gracious moderator, tag team moderator, and I just love everything that I heard. And let's just keep it going. It's so important that we keep the dialogue and the discussion going. Thank you.
Thank you so much, Councilwoman. And I want to thank all the panelists. And tonight was beautiful in so many ways. This was an intergenerational conversation. We have everybody from Gen Z to baby boomers all engaged in the conversation, and it's been very meaningful. As we all know, and has been alluded to, this is Women's History Month, and I could not think of a better way to spend it than honoring the legacy of Dr. Jewel Plummer Cobb with these powerful women. So my hat is off to Dr. Marcia Sill, to Dr. Tolu Oyetunde, to Miss Auntie Karen Nesbitt Good, to Councilwoman Patricia Perkins August, and to Director Johanna Calle from the New Jersey Health and Human Services area. your input, your demeanor, and the way that you just shared information in a way that made it accessible. We so appreciate that. And tonight we have lots of students that are here with us. And so what we've been able to do is to help arm them with information, with facts, but to also speak to them and address the questions that they had. So thank you so much for putting things in the chat box and for the panelists who answered those questions. I want to remind the students, if you're here, please use the link in the chat box for attendance. I'm going to encourage everybody to visit the steam.rutgers.edu website for more information and on our annual initiatives. And there's more to come. So if you enjoyed tonight, next week will be another treat. So I encourage you to join us next week. You can follow us on social media at STEM Her Story RU. And again, this has been a phenomenal event. So I want to thank you. And on behalf of my co-host, Ari, we both thank you, but I'm going to give her a minute to close us out. So thank you, Ari. Take it away.
I thought my mic was unmuted. But again, I want to say thank you to everyone who attended this. I know this is taking time at everyone's day, but this is time much needed to hear from each of these perspectives, from the medical perspective to the governmental side, to even the funeral side as well. Hearing from a funeral operator and hearing from all these different perspectives is very insightful and important, especially on a day-to-day basis, because this pandemic has been real, and I know it has affected everyone in different aspects of their lives, good and bad. You know, I know even though the bad portion has been a multitude, I know the small glimpse of good was being able to be at home with family. As much as some people didn't want to, you were able to be home. And this pandemic has really changed the shape of New Jersey as a whole. And I know it's going to take really years for New Jersey to be normal again, as we call it, normal, quote unquote. But we're in a new age, a new time, and it's very important to hear how, especially with the vaccination process, you know, this is something that we're actually stepping into as a state as a whole. Hearing this, the fearfulness of people, the fearfulness in our community, women of color. This is our panel, right? Hearing how people just don't want to get the vaccine, because I know that's something I've heard from a health perspective, me working in a doctor's office, some people not wanting to really get the vaccine because of their fearfulness. So I'm very, very thankful for all of you guys who have attended this panel tonight. I appreciate it from the bottom of my heart, both students and people who are not Rutgers students. Thank you for attending and listening to everybody tonight. And again, as Dr. McGinty said, if you have more time and outreach, feel free to email us at the steam.rutgers.edu if you have any more questions. I know there were some questions in the Q&A that we weren't able to answer. We can have one of our medical perspectives follow up with you guys individually if they have time, just to answer some of those questions. And if it's more of an academic one, you can reach me at vicepresident.rutgers@edu. And you can ask me some questions as well. I'm also on Instagram as well if you want to DM me as well. But yeah, I want to take more time because I know it's past 8. But thank you so much for attending this panel, and I look forward to seeing you guys virtually or hearing from you guys virtually as well. Thank you.
Thank you.